Hi friends, welcome to my YouTube channel. So today we are going to learn the osteology of sacrum. You know the sacrum is a large flattened triangular bone which is formed by the fusion of five sacral vertebrae. The sacrum articulates on either side with the pelvic bone to form the sacropelvic joint. What are the functions of the sacrum? The sacrum forms the posterior part of bony pelvis. It supports the vertebral column and it transmits the weight of the body to the pelvic girdle through the sacroiliac joints. In this video, we are going to see the anatomical position, general features, attachments, and relations. Come, let us get into the video. The sacrum is a triangular bone which is having an apex which is directed downwards and a base which is directed upwards. Four surfaces are there. We have a ventral surface or the pelvic surface. Then here we have a dorsal surface, and on either side this is the lateral surface. Two lateral surface, there is a dorsal surface, and here we have a ventral surface. Now let's see the anatomical position of the bone. Hold the sacrum in such a way that the pelvic surface of the bone is directed downwards and forwards, and the dorsal surface is directed upwards and backwards. And the base of the sacrum makes an angle of 30 degree with a horizontal plane. If you make a horizontal plane over here, the base of the sacrum makes an angle of 30 degree. So hold the sacrum in such a way that the pelvic surface is directed forwards and downwards, and the dorsal surface is directed upwards and backwards. Now let's see the details of the sacrum. The apex of the sacrum articulates with the coccyx to form the sacrococcygeal joint. Sacrococcygeal joint. Okay. And if you see the base of the sacrum, this is the base of the sacrum. Okay, so base of the sacrum is formed by the upper surface of the first sacral vertebra, that is the S1. It is directed upwards and forwards. This is the anatomical position. So this particular part, what you are seeing is the body of the first sacral vertebra, that is the S1. So here this part is articular. It has got a middle articular portion, and on either side non-articular part. This is articular part and the non-articular part. This non-articular part is a broad piece of bone. It's known as the ala of sacrum. Ala of sacrum. The body of the first sacral vertebra is articulated with the fifth lumbar vertebra, and this articulation makes an angle of 210 degree. That is known as a lumbosacral angle. Lumbosacral angle, which makes an angle of 210 degree. And I told you this is the body of the first sacral vertebra. On either side, you can see there is a large mass that is called ala of sacrum. Ala of sacrum. This ala of sacrum is formed by the fusion of costal and transverse elements. Costal and transverse element fuses to form this ala of sacrum. Now let's see the detailed features of sacrum. So here we have the base, and here we have the apex. Again we have pelvic surface, dorsal surface, and two lateral surfaces. The base of the sacrum is formed by the body of first sacral vertebra. It is directed upwards and forwards. And this particular part we are seeing is the articular part, and this lateral mass is non-articular. This articular part is articulated with the body of the fifth lumbar vertebra. Okay. And the anterior margin of this S1, the first sacral vertebra, this anterior margin, it has got a prominent anterior margin. This prominent anterior margin is known as a sacral promontory. Sacral promontory. Okay, and what are the structures related or attached to this ala of sacrum? Normally asked for Viva OC examinations. If you see this ala of sacrum, it has got a medial smooth part and lateral rough part. This lateral rough part gives attachment to, there is a muscle that is known as the iliacus. Iliacus takes origin from the iliac fossa of the pelvic bone. Okay, some part of the iliacus muscle takes origin from the lateral rough part of the ala of sacrum. And the medial smooth part is related to four structures. Four structures are related, and these structures from lateral to medial side are, We have obturator nerve, iliolumbar artery, lumbosacral trunk, and sympathetic chain. OILS. OILS. To remember, use these mnemonics. OILS. OILS. Okay. Now, behind the body of this S1, you can see there is a triangular vertebral foramina. Okay, this vertebral foramina of the sacrum fuses to form a canal over here. There is a canal you are seeing. This canal is the sacral canal. What are the other structures which is visible on the base of the sacrum? You can see posteriorly there are two large projections. They are the superior articular process. The vertebra has got superior articular process and inferior articular process. Okay, so this articular process of the S1 articulates with the inferior articular process of the fifth lumbar vertebra, L5. Here we have the apex of the sacrum. Apex of the sacrum is articulates with the coccyx to form the sacrococcygeal joint. Sacrococcygeal joint. Now let us see the surfaces of the sacrum. So here is the pelvic surface. Four surfaces again. We have the pelvic surface. Then there is a dorsal surface and two lateral surfaces. Now let us see the pelvic surface. Details of the pelvic surface. The pelvic surface is concave from above downwards and side to side. It is concave from above downwards and side to side. And if we examine this pelvic surface, you can see four transverse ridges are there. Here, 1, 2, 3, 4. Four transverse ridges are there. These transverse ridges represents the line of fusion of five sacral vertebrae. The sacrum as a large mass of bone which is formed by the fusion of five sacral vertebrae. So these individual sacral vertebrae fuses at these ridges, transverse ridges, which is very clearly seen on the pelvic surface of the sacrum. At the lateral end of these ridges, you can see these ridges. At the lateral end of the ridges, there are some foraminas are there. We have four pairs of foramina, and these foraminas are known as the anterior sacral foraminas. Anterior sacral foraminas. So you can see these anterior sacral foraminas, it goes backwards and communicates with the sacral canal. Anterior sacral foraminas transmits upper four sacral nerves and the branches of lateral sacral artery. In between these sacral foraminas, we can see four bar of bone represents the fused costal elements. Okay. Then lateral to this ventral sacral foraminas, this is the lateral mass. Again, let us see once again. So on the ventral surface, what are the features we can see? We can see the four transverse ridges. Just lateral to lateral ridges, we have four sacral foraminas are there. In between the sacral foraminas, we have the lateral mass, and this lateral mass fuses and forms the laminae. In between this foraminas, we have the laminae, and the lamina fuses to form the lateral mass. What are the structures related to this area or structures attached to this area? The piriformis muscle originates from the bodies of S2, S3, S4. Okay, so this area gives origin to piriformis muscle. Pelvic mesocolon is attached to the left of first sacral vertebra to the right side of the third sacral vertebra. So there is an oblique attachment of pelvic mesocolon. Remember, from the left of first sacral vertebra to the third right sacral vertebra, there is an oblique attachment, that is the pelvic mesocolon. And area above is covered by the peritoneum and area below is not covered by peritoneum. Now let's see the dorsal surface. The dorsal surface of the sacrum is rough and convex and is directed upwards and backwards. Let us see what are the features on the dorsal surface of the sacrum. In the midline, there is a crust. This crust is known as a median sacral crust. Median sacral crust represents the fused spinous processes. Spinous process of all these four sacral vertebrae fuse to form the medial sacral crest. Medial sacral crest has got four spines are there. Lateral to the median crest, the irregular convex part, that is known as the fused laminae. Okay, and the fused laminae is formed by the fusion of upper four sacral vertebrae, lamina of the upper four sacral vertebrae. Okay, so here we have the four sacral spines are there. Just laterally we have the fused lamina of the upper four sacral vertebrae. Just lateral to it, okay, just laterally we can see there is one more faint ridge. You can see there is a faint ridge that is known as the intermediate sacral crest. On either side we have two intermediate sacral crests are there. So here remember, this is the intermediate sacral crest, and this intermediate sacral crest is formed by the fusion of these articular process. You can see the first articular, superior articular process is prominent, okay, and the remaining articular process, both the inferior and superior articular process, fused to form the a crest like structure that is known as the intermediate crest. We have two intermediate crests, and this intermediate crest has got four tubercles also at the lowermost part. So here you can see this unfused part. This unfused part is known as a sacral hiatus. Sacral hiatus. So sacral hiatus, the lamina of the fifth vertebra, okay, remains unfused and form a inverted U-shaped part that is known as the sacral hiatus. Okay, and on either side of the sacral hiatus there is a projection that is known as the sacral conua. Okay, so the sacral conua is the inferior articular process of the fifth sacral vertebra. Now, lateral to this intermediate sacral crest, we have four dorsal sacral foramina are there. And what structures are passing through this one? Dorsal ramus of these first four sacral nerves are passing through this dorsal sacral foramina. Just laterally, there is one more crest here. You can see there is one more crest. That crests are known as the lateral sacral crest. Okay, so here we have the lateral sacral crest. Lateral, you can see the lateral sacral crest. Okay, again we have three crests are there. We have median sacral crest, over here. Then there is intermediate sacral crest. Okay, in between we have the fused lamina. Just lateral to this intermediate sacral crest, we have the dorsal sacral foramina are there. Just lateral to dorsal sacral foramina, we have the lateral sacral crest. Lateral sacral crest represents a fused transverse process. Okay, we have two muscles attached on the dorsal surface. The first muscle that is known as the erector spinae muscle. The erector spinae muscle arises from the U-shaped area onto the lateral sacral crest and the dorsal sacral crest. Okay, so just make a U-shaped mark over here like this. Starting from here, it is somewhat like this. Okay, so this U-shaped area gives origin to a muscle that is known as the erector spinae muscle. Erector spinae muscle, and the cavity of this particular U-shaped attachment. Okay, so this particular part gives origin to another muscle that is known as the multifidus. Multifidus. These dorsal sacral foramina are covered by the muscle multifidus. The dorsal ramus of the sacral nerves pierces the multifidus and comes out. Pierces this multifidus and comes out. Okay, let's see the lateral surface. Upper part of the lateral surface is articular. The upper articular part has got an ear shape, that is auricular articular facet. Auricular articular facet. Auricular shaped articular facet articulates with the pelvic bone to form the sacroiliac joint. The lower non-articular part gives attachment to some structures. This area gives attachment to gluteus maximus. This is the area of origin of some fibers of gluteus maximus. Area below gives attachment to three ligaments are sacrospinous ligament, sacrotuberous ligament, sacrococcygeal ligament. Sacrospinous, sacrotuberous, sacrococcygeal. Okay. Now I told you there is a sacral foramina and it forms a sacral canal. So it forms the sacral. You can see the sacral canal is here. Okay, sacral canal, and the sacral canal, which is formed by the fusion of the vertebral canal of all the sacral vertebrae. Okay, and the sacral canal is communicated dorsally. It communicated through the dorsal sacral foramina, and ventrally through the anterior or ventral sacral foramina. Ventral sacral foramina. What are the structures passing through this sacral canal? That is a lower part of the chorda equina, phylum terminale, spinal meninges, and lateral sacral vessels. And below we have the sacral hiatus. What are the structures emerges to the sacral hiatus? Sacral hiatus. We have the phylum terminale, fifth sacral spinal nerves, and pair of coccygeal nerves. Three structures are passing through this sacral hiatus. Now, let us learn a new term, that is sacral index. What is sacral index? Sacral index is the ratio between the length and the breadth of the sacrum. So here is the breadth of the sacrum, okay, and here we have the length of the sacrum. Length of the sacrum. Sacral index is the ratio between length and breadth of the sacrum. Okay, how we can calculate the sacral index? It is breadth of the sacrum into 100 divided by the length of the sacrum. And the sacral index is 105% in male and 115 in females. Now let's see the difference between male sacrum and female sacrum. The first one is the base of the sacrum. Okay, the if we see, this is the body and this is a lateral mass. Okay, in male bone, the transverse diameter of the body is larger than that of the ala. Okay, this is wider in males and this is shorter. Okay, and in females it is different. Okay, the transverse diameter of the ala is higher than that of the body. Okay, transverse diameter of the ala of sacrum is higher in females. Okay, in males it is longer. The sacrum is longer, and in females it is broader. Female sacrum is broader and male sacrum is longer. And again, in males it is heavier when compared to females. Female is incomparably lighter. Okay, male bone, that is a more muscular impressions we can. Okay, but females is less marked. Another feature is this concavity. Okay, in males it is smoothly curved, and in case of females it is abruptly curved. There is a large curvature you can see here. It is more curved in case of females. In case of males, the lateral articular surface, it extends up to 2.5 sacral vertebra. 2.5 sacral vertebra. But in case of females, it is shorter. It extends up to this upper two sacral vertebra. Okay, in males it is 2.5 sacral vertebra, but in case of males it is in females. In case of females it is upper two extends up to two sacral vertebra. Okay, so these are the difference between male and female sacrum. Okay, now that was all about the sacrum. Hope you understood the osteology of the sacrum. And if you found this video is helpful, please share it with your friends. Thank you.